Hi my dear students, now let us discuss MCQ on RBC. In previous class we have discussed almost 75 questions from this topic. Now let us discuss remaining questions. Here you see the first question. The central pallor seen in RBC under microscope due to. The central pallor seen in microscope due to lack of hemoglobin in center, cell membrane thickening, nucleus present, and option D, presence of enzymes. Here the answer is A, lack of hemoglobin in center, and this is the reason. Lack of hemoglobin in the center in the RBC is the reason the center area of RBC looks pallor. Then the next question. The next question, the immature form of RBC in circulation is called. The immature form of RBC in circulation is called. Option A, myeloblast. Option B, reticulocyte. Option C, lymphoblast. And option D, megakaryocyte. The immature form of RBC in circulation is called myeloblast, reticulocyte, lymphoblast, megakaryocyte. And the answer is reticulocyte and reticulocytes. So nothing but reticulocytes are called immature RBCs, and their count indicates bone marrow activity. The next question, hemoglobin is composed of protein and glucose, heme plus globin, lipid and protein, iron and fatty acids. And the answer is B, hemoglobin composed of heme plus globin. Then next question, normal thickness of RBC peripherally. Normal thickness of RBC peripherally. The normal thickness of RBC peripherally 1 micrometer, 2 micrometers, 3 micrometer, 4 micrometers. And the option is B, 2 micrometers. The normal thickness of RBC at peripherally is 2 micrometers. Okay. Central thickness of RBC is about 0.5 micrometer, 1 micrometer, 1.5 micrometer, 2 micrometer, and the answer is 0.5 micrometer. The next question, daily production of RBC in adult is. Daily production of RBC in adult is 1 million per second, 2 million per second, 3 millions per second, 4 millions per second. Daily production of RBC in adult is about 1 million per second, 2 million per second, 3 million per second, 4 million per second. And the answer is 2 million per second. Option B. Then next question, Normal HB in adult female. Normal HB level in adult female 9 to 11 grams per deciliter. Option B 11 to 13 grams per deciliter. Option C 12 to 16 grams per deciliter. And option D 16 to 18 grams per deciliter. Normal HB in adult females 9 to 11 grams per deciliter. Option B 11 to 13 grams per deciliter. 12 to 16 grams per deciliter. D 16 to 18 grams per deciliter. And the answer is C 12 to 16 grams per deciliter. Then next question. Normal hemoglobin level in adult females. Normal hemoglobin level in adult females. Option A 10 to 12 grams per deciliter. Option B 12 to 14 grams per deciliter. Option C 13 to 18 grams per deciliter. Option D 18 to 20 grams per deciliter. And the answer is option C 13 to 8 grams per deciliter is a normal HB level in adult females. Then next question. Normal HB hemoglobin level in newborns. Normal hemoglobin level in newborns 10 to 12 grams per deciliter. Option B 12 to 14 grams per deciliter. Option C 12 to 14 to 20 grams per deciliter. And option D 20 to 22 grams per deciliter. Normal HB level in newborns. So can anyone give the answer in comment box? Normal HB in newborns 10 to 12 grams per deciliter, 12 to 14 grams per deciliter, 14 to 20 grams per deciliter, 20 to 22 grams per deciliter. So the answer is 14 to 20 grams per deciliter is a normal HB level in newborn. Then next question. RBC destroyed by which process? RBC destroyed by which process? Apoptosis, hemolysis, phagocytosis by macrophages, or by necrosis? Option D necrosis. Option A apoptosis, hemolysis, phagocytosis by macrophages, or option D necrosis. And the answer is C. RBC is destroyed by the process phagocytosis by macrophages. The phagocytosis is a cellular process in which phagocytes engulf and internalize large particles such as bacteria, debris, dead cells to eliminate from the body. So this is the process of phagocytosis. The next question. RBC lacks. RBC lacks. Option A hemoglobin, B nucleus, C plasma membrane, D cytoplasm. RBC lack of hemoglobin, nucleus, plasma membrane, cytoplasm, and the answer is RBC lacks nucleus. Option A. Then next question. Which type of hemoglobin is present in fetus? Which type of hemoglobin is present in fetus? Option A hemoglobin A type, hemoglobin A2 type, hemoglobin F type, or hemoglobin S type. And the answer is which type of hemoglobin is present in fetus? Hemoglobin A type, hemoglobin A2 type, hemoglobin F type, hemoglobin HbS type. And the answer is hemoglobin F type. Hemoglobin F type you can see in the fetus. And here you see the different types of hemoglobin. So this hemoglobin A type we see in adult. And not only that, this hemoglobin A2 is also special type of hemoglobin composed of 2 alpha and 2 delta globin chains. And this HB hemoglobin F type found in fetus, and this hemoglobin H type. So this is an abnormal type of hemoglobin that cause RBC to become rigid and sickle shape. Then next question. So the precursor cell of RBC in bone marrow is the precursor myeloblast, erythroblast, megakaryocyte, monoblast. The precursor cell of RBC in bone marrow is myeloblast, erythroblast, megakaryocyte, monoblast. And the answer is erythroblast. The next question. RBCs are measured in laboratory by. Red blood cells are measured in laboratory by hemocytometer, spirometer, sphygmomanometer, thermometer. RBC cells are measured in laboratory through the hemocytometer, spirometer, sphygmomanometer, thermometer. Here you have the answer, that is hemocytometer. Then next question, which factor increase RBC count? Which factor increase RBC count? High altitude, low altitude, anemia, hemolysis. Is a factor increases the RBC count. The next question, Rolex formation of RBC occurs in. Rolex formation of RBC occurs in normal blood, multiple myeloma, leukemia, malaria. Rolex formation of RBC occurs in normal blood, multiple myeloma, leukemia, malaria. And the answer is multiple myeloma is the condition which forms or which makes Rolex formation of RBC. Then here you see what is the meaning of Rolex formation. So here the stacking of RBC cells or the formation of RBC cells into columns, it primarily caused by increased level of plasma protein like a fibrinogen or immunoglobulin. The next question, RBCs are suspended in plasma, lymph, platelets, serum. RBCs are suspended in plasma, lymph, platelets, serum. And the answer is plasma. RBCs are suspended in plasma. Then next question, hemopoietic stem cells give rise to. Hemopoietic stem cells gives rise to RBCs, WBCs, platelets, all the above. And the answer is hemopoietic stem cell gives rise to all the above, RBCs, platelets as well as platelets. So HPSC is nothing but hemopoietic stem cells are the immature cells give rise to all types of blood cells like RBC, WBC, platelets. Then next question, hemoglobin F. Hemoglobin F type is found in, or hemoglobin F type is called fetal hemoglobin, adult hemoglobin, mutant hemoglobin, iron free hemoglobin. Fetal hemoglobin, adult hemoglobin, mutant hemoglobin, iron free hemoglobin. And the answer is fetal hemoglobin, option A. The next question, the major support system in RBC. The major support system in RBC, phosphate buffer, bicarbonate buffer, protein buffer, chloride shifter. The major support system in RBC, phosphate buffer, bicarbonate buffer, protein buffer, chloride shifter. And the answer is B, bicarbonate buffer. So this is about MCQ on RBC. So in the next class, again I am back with the remaining MCQ of RBC. Thank you.